We have a lady here for a breast aug today. You can see sisters not twins, a little asymmetry, a little bit more fullness here. Left inframammary fold's a little bit higher. That fold right here, this is what goes into the skin that goes into the rib area. Is generally higher on the left versus right on almost every single lady, and it is true with her. And so we went through it all. You know, should we do a little bit larger on this side versus this side? She's like, no. So she chose 380 on both sides, and that's what we went to. I'll show you that here in a second. All right, you guys. So here she is. She's got 380 cc's. She's looking really, really good. They are sitting high. They always sit high. They will come down over time, fall into place. What else can I teach you guys about this? Yeah, so incisions are down low, inframammary fold. What happens here is they sit up here, they sit high. As they come down, it rounds out, and this little incision here ends up falling right into the fold area. What implants do is they help augment your baseline where you're at. So you can see she actually has she does have a huge improvement from where she was before with its 380s. It goes up about 2 breast cup sizes, but there's still some asymmetries there, and we tell that to every single patient. You'll still have some subtle asymmetries because they were there before, and a breast augmentation does not fix asymmetry. What a breast augmentation does is it gives you more volume. So those asymmetries, like we talked about, is one side was a little bit larger, the side was a little bit larger than this side. We could have gone a little bit larger on this side, but sometimes when you go a little bit larger on this side, then this side looks a little bit more. The second thing is the inframammary fold, and where the inframammary fold was at. This inframammary fold is a little bit higher than this side. So the question would be, well then, can you drop this inframammary fold for it to be at the same level as this? And theoretically, yes, you could drop a fold, but what a fold is it's thick tissue that's going into the chest wall area. And when you drop that fold, that means you're disrupting or cutting off that tissue and trying to create a new fold. And when you do that, you really increase the risk of this implant dropping down below and getting what's called a double bubble. So we do not like to create a new fold because it could just lead to worse complications over time. The second thing would be, well, can you then lift the fold that's lower up higher? So could we bring this fold up higher? Again, you're trying to create an unnatural fold that's higher, and you're trying to then sew in tissue, and then that can lead to just more of an indented area. So you end up having the area of the fold that was the original, the OG fold here, and then you try to create a new fold up higher, and then it can cause just kind of this artificial look where the skin's pulled into an area that naturally wasn't. So what we like to do, and most people do, is we keep the folds as they naturally were, keep the tissue where it naturally is, place the implants in, and give you that augmentation and that change that you want with the little small asymmetries you naturally had.